My knee has been giving me trouble for about 3 or 4 years. He said, where are your crutches? What's the bright orange? Where's that coming from? The anti-inflammatory part of curcumin. He said he's never seen anything like it.
Well, guys, we're doing another interview. We're here with Graeme today. Thanks, Graeme. Thanks for coming along.
My pleasure.
How are you?
I'm good, actually.
Excellent.
Thank you. It's a beautiful day.
It is a beautiful day. Look around. Beautiful spot. First of all, Graeme is actually, with his wife, the supplier of the curcumin powder. A lot of you guys are actually taking. And the second thing is Graeme had a knee surgery recently.
Yes.
And when he told me how this all went, I said, we need to put this into an interview and share with you guys, simply because it's such a great story. Maybe we start there with your knee story. What happened?
Yeah, well, that's a good place to start. My knee has been giving me trouble for about 3 or 4 years. I've always been a tennis player all my life, and I think I finally wore it out. And I've actually been taking a lot of curcumin over the last 3 or 4 years, and so I've been putting off, the knee surgery because of taking a lot of curcumin. But finally it got too much and I figured I had to get the knee surgery.
Yeah.
So I tracked down, I think it's called Gold Coast Orthopedic, and Dr. Talbot, and he's a very good surgeon, well recommended, all those things. Went to see him and had the surgery done, and after I was back on my feet a little bit after the surgery, he said, come back and see me after about a week or 10 days.
Okay.
Right, and I'll have a quick look and make sure you're okay. And he gave me a list of recommendations. You have to, use crutches, don't do this, don't do that, don't drive a car, don't do any of those things, right? And so I went to see him after 10 days, and he said, what are you doing? I said, what do you mean? He said, you just walked in here. And I said, right. He said, where are your crutches? I said, I don't need them. He said, you can't tell me you actually are walking around without crutches. I said, yes. And I said, as a matter of fact, I drove here.
That's crazy.
After 10 days. And he's going, you're crazy. He said, let me have a look at this leg. And so I pulled down, I was wearing track pants. I pulled down the track pants, and he'd put a clear tape right over the actual incision, and he put this clear tape on that. And the clear tape was actually still in place, everything okay, but it was bright orange down the middle, right on top of where the incision was.
Wow.
He said, what's the bright orange? Where's that coming from? And I said, well, I guess it's because I take a lot of curcumin and it's in my blood, and because it's getting, it's likely to be infected, the anti-inflammatory part of curcumin is depositing it on the wound, and in actual fact it has stopped it getting inflamed.
Great.
He said, that's unbelievable. He said he's never seen anything like it, and he paid us a really wonderful compliment. He said he's going to recommend it to his patients, and more importantly, he's going to give it to his 80-year-old mother who's got arthritis.
Wow.
So the surgeon is going to actually recommend that. And when I went back to see him again in a couple of weeks after that, I walked in, and I just walked in normally, and he said, I've got something for you. And I said, right. He said, look, I've got all these printouts about how curcumin helps post-operative.
Yeah.
And so he's showing me all these things.
So he did his own research.
His own research.
After he saw what happened.
Correct. And he's saying, look at this one, and how about that one? And he said, this is incredible. Yeah. And so he was really impressed, and so I actually got a lot from that. And he was saying that I think that in his case, at least, it's kind of an eye-opener that non-pharmaceutical product can help so much.
That's great. Yeah. So a knee replacement, 100% knee replacement.
Yep.
What did he say? How long should it, from his experience, take for you to be able to walk again, let's say without crutches?
He said it would take at least a month on crutches. It took me 8 days.
So that's the first thing. So 8 days.
Yeah.
And you're not even going back with the crutches. Plus then the healing itself was a lot faster.
A lot faster. I would say within 2 weeks, there was actually very little redness, and within a month it was completely healed. You wouldn't know it was there.
Wow.
Right now you can't tell that I've had an operation.
Wow.
Right, and it probably took a month for it to be gone and healed and
Yeah.
everything okay.
Yeah.
And now it's probably, I don't know, 2 months, and I don't have any pain, no limping, no nothing.
Wow.
Right,
And 2 months since the surgery.
yeah.
No, we were just walking to a cafe for me to get the coffee, and then walking to this spot, and there's like, I mean, you're not 20 anymore, but
No.
exactly, no limping, no like, oh, pain, and that's what, when you told me that, I'm like, that's just great. It also shows how good the product that you're actually selling to us and that you're selling to your customers, how good it is. One important information maybe for you guys is how much curcumin are you taking prior to the operation over the previous years, and how much are you taking at the moment?
I increased the dosage a month prior the operation to about 1 teaspoon per day, about
Double.
3,000 milligrams.
Yeah.
So it's more than normal.
Yeah.
But if you look at the report from Harvard Medical School, they were talking about 500 milligrams 3 times a day. So it's not completely out of the ordinary.
Yeah.
And I think that really helped a lot, because that's what enabled it to actually actively attack the inflammation part of the problem. You know?
So what I do to, when customers ask me how much should I take, I've got arthritis, I usually say, well, you should take double dosage for a month.
Correct.
Maybe even longer, because any like rather double dosage or even more of a natural supplement like curcumin than some synthetic drugs that you buy at the pharmacy.
For
so I
sure.
guess, and everyone understands that the recommended dosage is 1500 milligram, as Graeme said, for curcumin. But if you take 3000, it's not going to kill you and not going to do any damage
No.
from everything I read, from everything you read.
Yep.
So keep that in mind, guys, because we had people asking after the last interview, how much curcumin are these ladies actually taking, who had, as some of you might remember, similar results. They were active athletes in their youth, knee issues, not replacements, but arthroscopies, nothing helped. So that's just 100% in line. Just your story is even more incredible, because not using the crutches a week later is just like, wow.
Yeah.
So
well,
good.
The stupid part is I bought the crutches. I think they cost me $40 for the aluminium ones, and I'm going, what a stupid thing to buy. I used them about 3 times.
Now that's a great story, and it's great to see that a lot of these highly educated people who have years of experience also coming to that conclusion. Great. Thanks, Graeme.
Pleasure, my pleasure, and I'm glad that we can share it. You know?
Appreciate your time. That was excellent. I hope you guys enjoyed that, and we're looking forward to get any feedback, hearing from you. Thank you so much.
Thank you.
Great.
Good. Cheers.